Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens. We have our very special guest today is Dr. Khan. Good morning.
Good morning. Thank you for having me.
Oh, not a problem. This is good for me as well. So we're going to be talking about heart health and learn to be heart smart. And so you get a lot of acronyms in the legal field as well as medicine. And one of those acronyms that we're hearing a lot about is CHD. Can you tell our listeners what that is?
Sure. So heart disease, as you know, has includes a number of diseases. CHD is one of the important components of heart disease that we see here in our community. CHD stands for coronary heart disease. And coronary are the arteries that supply the heart muscle that lead to heart attacks, chest pains, heart failure. So when we talk about CHD, we're referring to how to prevent heart disease, how to treat blockages in these arteries, how to prevent these blockages, and therefore prevent heart attacks.
So how does someone know that they're at risk?
So coronary heart disease or blockage in the arteries or atherosclerosis, that's another term, I'll throw it in there for some of your viewers, that leads to plaque formation. And plaque is an aggregation of components in the blood that include cholesterol and other components that will eventually block the artery or occlude the artery, as we call it, and lead to heart attacks. And so the risk factors for developing those plaques, atherosclerotic plaques, as we call them, there are 5 major risk factors, and then there are others as well. So the 5 major ones that everyone should know are diabetes, high cholesterol, smoking, high blood pressure, and family history of heart disease. Those are the 5 main ones. Now, there are some others which are not as important, but fairly important: obesity, lack of exercise, sedentary lifestyle, mental stress. So those are the others: heart, kidney failure, things of that nature. So those are the other risk factors as well. All these risk factors lead to that plaque or the atherosclerosis process to speed up. And as it speeds up, it leads to this accumulation of material that occludes the artery or closes up the artery, which leads to a heart attack or chest pain.
So I've heard that most women in particular have a difficulty determining whether they're actually having a heart attack because our symptoms seem to be a little different than men's. So what kinds of things that should we be looking for specifically as women? Are there signs that occur whether you're male or female? Are there signs that occur if you're just male, more so than others? Because I think I've read somewhere that it is a little different, that between male and female as far as symptoms. Can you kind of help clarify that for me a little bit?
You're absolutely correct. So women, over the last many years of research, I think the doctors have found that women do not tend to have the same type of symptoms as men do, what we refer to them as typical symptoms. So women may not have that kind of chest pain that is typically described in textbooks as somebody having chest pain, which is clutching their chest and telling their doctor that they feel like there is an elephant sitting on their chest, or heaviness, or pain that comes on with exertion and goes away with the rest. They may not have those classical symptoms. They may have non-classical symptoms. So in the case of women, I think any female, particularly postmenopausal female, which is a much higher risk, who has the risk factors that I told you earlier, comes with any kind of symptom, I think we have to take them seriously and put them through proper testing and therefore treatment.
So they come to see you, or they're in the emergency room, they think they're having a heart attack. What happens next?
You talk about general scenario of heart attack. So typically the way it works in our country, and I'm sure other countries in the world as well, is that if somebody's having a heart attack and somebody hopefully knows what a heart attack sign, is, or calls 911. First of all, they tell their loved ones that I'm having chest pain, I'm sweating profusely, there's shortness of breath, I can't breathe, I got an elephant sitting on my chest. I think I might be having a heart attack. My dad did, or my uncle did, my brother did. I think it is heart. I am a smoker. Uh, the family members should call 911 immediately, and they do. In some cases, family members drive them to the emergency room. So we'll take both scenarios to describe to you. The first scenario, the ideal scenario is call 911 because ambulance will arrive in your home within 5 or 10 minutes, and they'll start treatment right on site. If not, and you are driven if you are the patient and you are driven, and I'm not referring to you, I'm talking about a patient, a patient is driven to the emergency room. And so the first method for us to diagnose a heart attack immediately is to get an EKG. And in the case of heart attack, not in the case of heart disease or chest pain, but in the case of particularly heart attack, an EKG is very diagnostic. So an EKG immediately is performed. It can be performed at your home if you call 911. So that's one advantage. Or it can be done in the emergency room if you arrived in the emergency room with a family member or a loved one. The EKG will show a heart attack, and this will start a whole process. The whole ball will start rolling. Immediately, the cath lab team is called, the doctor on call is called, and our job in this country to meet the standard of care is that we must open this artery, which is closing based on that EKG and chest pain, within 90 minutes. That's called door to balloon time. As soon as the patient hits the door of the hospital, our job is to open the artery within 90 minutes. Actually, the ideal goal is 60 minutes, but 90 minutes. So therefore, a person who's having a heart attack gets their artery open in 90 minutes. And when that happens, we protect a lot of damage. We prevent a lot of damage. It's very helpful to them. However, let me give you another scenario. They might live in a community where there's a hospital that does not do cath lab, does not have a cath lab, does not do angioplasty. What happens then? Let's say they are in a smaller community, a rural community. The hospital the ambulance takes them to a hospital close by, and they don't have a cath lab, but they do have a heart doctor. Or maybe they don't even have a heart doctor. They have a doctor per se. They will get a blood thinner, a clot buster, and then they will be transferred to a facility that does do angioplasty. This all happens within 2 hours as well. So that's how typically we treat heart attacks.
So I noticed that modern medicine has really come a long ways. And so are there new surgical and non-surgical ways to open clogged arteries and prevent a heart attack?
Yes, absolutely. So they're not very new ways, but heart disease and CHD in particular, the treatment is relatively new. As some of you might know, that the first bypass was done in the 1960s. In fact, the first surgery of the heart was done on congenital heart disease in University of Maryland, I think. That was back in 1968 or something. So first bypass was done in the late 1960s. The first angioplasty was done in the late 1970s and early 80s by a fellow named Dr. Grunzik at Emory, and he did a stent. And the stents did not come in until the mid-90s. So all of this is pretty new for us. But the stents have gone through some revolutionary changes. The type of stents we use, the kind of structure they have has changed over the years. Researchers, biomedical engineers have been working diligently in improving the quality of these stents. And so now I can comfortably say the stents that we've been using for the last 10 years at least are so good they're equivalent to a bypass. And the net result is there are far few bypasses now when we can fix them with a stent, which is a much more convenient test where the patient is awake and can go home the same day versus the bypass. So stents have revolutionized the treatment of CHD or coronary heart disease or blockages or clogged arteries, if you want to call them.
Perfect. And so I think you talked about some risk factors earlier. So the things that we can do to lower our risk of having a heart attack, I'm assuming is exercise is one.
Sure.
What was those factors? Not smoking,
Right.
What else can we do to help kind of lower
Well,
our risk?
as you saw in those risk factors, there is a risk. There are some risk factors we can't change. Like we cannot change the genetics.
Yeah, genetics.
You're born with heart disease in your family, where someone in your family, a dad or a brother, has had a heart attack or a bypass in their early 40s or even younger. Well, you've got bad genes, unfortunately. You can't change it.
Can't
But you
change.
can change other risk factors. So the other risk factor, like you mentioned, you can change is you can control your diabetes. Make sure you're going to a diabetologist or a doctor who can control your diabetes very well, very tight control. Someone who can lower your cholesterol and your blood pressure if you have one. Start exercising. I think that there's no such thing as fountain of youth, but activity, exercise, cardio, as we call it, whatever name you call it, brisk walking, running, jogging, depending what sort of knees and hips you have and what your age is. Do whatever you can, move. That really is the fountain of youth. That is one way to keep these arteries unclogged. So I think exercise, watching your diet, going more with eating less meat. I think I just should plug in there. Meat itself has got so much stuff that we don't need. I'm not saying go completely to plant-based diet, even though there's a lot of interest in the country in plant-based diets, but do everything in moderation. If you're having meat every day, 5 days a week, or 10 days or 10 times a week, maybe reduce that. Instead of having it twice a day, have it once a day. Start with that. Maybe add more fish to your diet. Try to go with more barbecue type of meat or broiled meat. Don't use any oil on it. Try to add more vegetables. Most people, men particularly, don't eat a lot of vegetables. Add green leafy vegetables to your diet. You know, add legumes and things like that, which are rich in protein, or beans. So, green leafy vegetables are very good. Orange and green leafy vegetables are good for you. So I think adding that sort of thing is helpful. Diet, exercise is something is in our control. We can do. The rest of the stuff may require medications and treatment, and we need to do that too.
All right, so now we're going to get to the good stuff. So, number one reason you're here today. Definitely give us a lot of education, but I want you to talk about your new book.
Okay, great. Well, my new book is all about what you're talking about. I think it's this new book is basically answers to kind of questions you had for me today. New book is about the my dialogue with my patients over the last 20 years. Most of the book was the idea came to me because we don't have the time as doctors to speak to patients when they're in our clinic. We have to see a lot of patients and we are in a hurry. And any patient who wants to have a detailed discussion, uh, unfortunately, doesn't get to do so. But this book allows them to have that. And so, I would say all the questions I tried to, but I think most of the questions are answered. The question you asked me today are also answered. So there is a chapter on, and I give examples of my patients. So almost every chapter has patients. Obviously, the names are incorrect. We had to hide the names, but the stories are correct. And so the profession may be incorrect too, but most of them are correct. So you will see that in my book we discuss risk factors with stories. We talk about how to control those risk factors. We talk about how to diagnose heart disease. I talk about how to fix them with stories. I also talk about diet, for which I did some research also because I'm not a dietologist or diet specialist. So I put some effort in it, and hopefully it will be useful. We talk about exercise. I also talk about mental health and mental exercise, which is also important. So I think it's just not exercising your body, but exercising your brain a little bit and relaxing your brain. And so I discussed almost every avenue that will help people who are concerned about heart disease, whether their loved ones have it or they have it or they just want to know more about it.
And the name of the book?
The name of the book is Be Heart Smart. Understand, diagnose,
Okay.
and treat heart disease. And
All right.
it is just like the name suggests, it is what it is.
Perfect. So if someone wants a book, how do they get one?
So the book is I actually got two editions. We changed a few things in the second edition, but not much. Pretty much the same. And so it's available on actually in Houston. I was told that it's available in bookstore, all the Barnes and Noble bookstores, actually in physically. But you can also, if you don't find it physically, they'll get it one for you. But also available on a lot of websites. It's available on Amazon, which is the easiest. A lot of people are now Amazon shoppers, so it's on Amazon. It's an audio also. You got audio, you got books and actual physical book. And then, like I said, Barnes and Nobles and pretty much all major bookstores are carrying the book now.
That's great. And so that's great. That gives so much more opportunity for everybody to grab one. And so.
Yeah, thank you. I appreciate that.
Perfect.
Enjoy that.
I just want to thank you, Dr. Khan, for being on the show today. Education for us is very important. We have a what we call our senior population, but really our second half of life population that we're always trying to educate and do more for them. So I just want to thank you so much for being on the show today.
Thank you very much. I enjoyed it too, and I'm happy to help the community. I think heart disease is the number one killer. It's good to know about it. It's perfect. Sounds great. You've got a great medium here. Thank you so much.
Not a problem. Have a good weekend.
You too. Take care. Bye-bye.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.